Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental in Encinitas. Today I'm joined by Dr. Brian Stensler, the president of Dream Wellness and also the past president of the California Chiropractic Association. In my last video, I talked about the importance of having a tongue tie treated and how a tongue tie in a newborn can affect the craniofacial development of a child. Today I have Dr. Brian with me to help discuss how we can support your child's development from newborn through infancy and adolescence. One of the things I noticed with my son in particular was having had a natural vaginal birth. I noticed his head was very, very dramatically squished as he came through the canal. And I also noticed he was posturing towards one side, almost like his head was stuck. He was really favoring leaning his head towards one side, which led to me to find someone who specializes in pediatric chiropractics.
I like to start with a little background about what we do as chiropractors, because people are like, pediatric chiropractor, are you kidding me? And the first thing we need to understand is that not children and infants, they don't get adjusted the same way as adults.
Correct.
But the most important thing that we look at, though, is do they need an adjustment or not? Even in a natural childbirth, the way that babies are delivered these days, it's very forceful. And what we do as chiropractors is we look to see if a child or an adult has something called a subluxation. And so a subluxation of the vertebrae is when a bone in the spine moves out of its proper position, puts pressure on these delicate nerves, and disrupts the communication between the brain and the body. And so if a child develops a subluxation from coming out of the womb, or even if it's a C-section, basically what happens is it can kind of create an imbalance where the muscles may not be functioning properly. They may contract too much on one side versus the other side, causing an acute torticollis, wry neck, or head to the side, as we talked about before. And that's just one of many issues that can happen as a birth process. What causes the subluxations in the first place is the inability to adapt to a stress, a chemical stress, physical stress, or emotional stress. So chemical stresses could be consuming new food items, breathing in new air that they've never had before. An emotional stress could be, hey, I was in this great warm environment with these sounds that I'm used to, and all of a sudden I'm in this world that's very emotionally stressful for me. And then there's the physical stress of actually having the body come out of that little hole, regardless of whether it's coming from the belly or from the vaginal area. And so the chemical, physical, emotional stresses are very common for newborns to have these misaligned vertebrae, these subluxations. So we want to very, very delicately address those and adjust them. And so like when we adjust your little baby, we just basically use a little tiny tap with the finger and just kind of feel the bone align. And all of a sudden you see that all of a sudden the head begins to straighten out, and the neurological implications of the subluxation before are now relieved, they're now removed. And so not only does that affect his muscular function, but it also affects all the organs and glands that those delicate nerve fibers feed information to. So we see a lot of children that come in with chronic ear infections, allergies, asthma, colic. I mean, colic is like one of the easiest things that we deal with. Even you're dealing with acid reflux that we see. And we're not necessarily treating those problems to treat the problem. What we're doing is we're addressing the subluxation, the misaligned vertebra, and all of a sudden the body does exactly what it's supposed to do.
Well, one thing I noticed is how much he enjoys it when you're holding him. It looks like he's just softly cradling him, giving him a little hug. It's not at all what you would picture chiropractic being. And it's so interesting to see that when you hit the right spot on his neck, how he's smiling, he's cooing, he's very engaged with you, and seems to really enjoy the whole process as if he's getting relief from it. And I also noticed in my mommy group how many women were talking about having to prop their child's head up with socks filled with rice or toys to try and get their child to stop rolling so hard towards one side. I also noticed how some women in the lactation group were talking about how their child would only feed from one breast. Now that I'm more informed, I'm thinking, well, the child is favoring one position because their neck is probably stuck there. So what do you see when these parents come in?
Well, you're exactly right. Children innately know that something good is happening here. And to see a chiropractor also that not only looks at the manual alignment, but also does a little bit of craniosacral work to help balance out the meninges and the spinal column and what have you is always nice, which we always do with your little one. And he really seems to enjoy that. He gets into a great relaxation state. His breathing improves, his feeding, his nursing, and everything. So when parents come to us, they're sometimes a little confused. They just don't understand the relationship between chiropractic and their newborn's health, whether they were dealing with a tongue tie issue, whether they're dealing with the head turn and what have you. So we just educate them. And the most important thing is to find a chiropractor who will educate the parents and that does a good analysis. We use our palpation skills to determine what's in and out of alignment. We look, we do some mirror imaging, and basically see how is the range of motion of that child.
Dr. Brian, I had no idea prior to this experience that chiropractors even treated newborns or infants. Does it require special training?
You know, that's a really great question. When we care for newborns, there are very specific techniques that we do, and every chiropractic college teaches pediatric care.
Okay.
It is important to know that there are some chiropractors that do additional training in pediatric. And there are a few different types of certifications out there. So you can always look at different websites and see the ICPA is a really great certification. And so just because somebody doesn't have that certification doesn't mean that they're not equipped to take care of newborns and to take care of children. But you know that they've had extra training in that.
Mm-hmm. In my last video, we talked a lot about the importance of having your child evaluated for a tongue tie if they're not latching or feeding properly. But another thing that's commonly talked about in my mommy group is children who are very, very colicky or who can't keep any food down. We talked about the relationship of how the tongue flow and its peristalsis and movement is affected by a tongue tie, but it also could very well be chiropractic. What do you notice is the common complaint with some of these mothers?
Yeah, so of course you've got to look at what's going on in the mouth and see if there's a restriction there. Short of a restriction there, we want to look at the spinal alignment. So when we're dealing with children with colic, the most common areas that we see subluxations, those misalignments, would be in the upper cervical area or in the mid-dorsal, the mid-thoracic area, right in the middle of the back, around the T6 area, the sixth thoracic vertebra, which goes to the stomach. And then also you have digestive organs below that. And so what we notice is when there's stress in those areas, then the gastric system is just not able to do what it's supposed to do. And that's why you want to always get evaluated by a chiropractor who looks at the spine globally and not just necessarily one area.
Now, if a child sought no treatment whatsoever, because again, I had no idea it was even treatable at a young age.
Right.
What are some of the possible side effects into adulthood?
First of all, you say as the branch grows crooked, so grows the tree, right? You want to make sure that posturally that everything is in proper alignment. As a child, if you have these subluxations that don't get corrected, that can lead to a lot of other digestive issues later on. It can lead to respiratory breathing issues, a lot of asthma, and issues like that, because the structure is just not perfect, and structure determines function. So we want to make sure that we have an intact structure from early on before those muscles solidify and don't allow the proper expression of normal alignment.
Dr. Brian, this was so informative. I really appreciate all the information you've given the audience as well as your time. How does someone go about finding a chiropractor to treat their newborn?
First thing that you can do certainly is ask some of your friends if they've ever taken their children to a chiropractor. You'd be surprised in their own personal network. You could go to dreamwellness.com. They could contact me and I could direct them to a chiropractor wherever it is in the world that they are, because I know that you have a lot of people that watch your videos. Having been the past president of the California Chiropractic Association, I know a lot of chiropractors in California. I know a lot in New York because Dream Wellness has locations in both those areas. But then, of course, I could be a resource to anybody that is looking and they're a little skeptical or concerned.
I hope you found this video informative. It's something I'm really passionate about. And if you'd like to learn more, feel free to contact me at Moonlight Beach Dental.